We have a question from Rose Marie, who is concerned about her young son who has autism spectrum disorder, and what he's doing apparently is touching people's feet in public. So she's wondering, how do I handle this? Well, Rosemary, I'm sure this makes for some fairly embarrassing situations for you, and it would certainly be nice if you had some way of handling it. Here's what we would suggest. I don't know if you're familiar with 1-2-3 Magic program, but I would get a copy of the book and I would learn how to do what we call counting. Now, 1-2-3 Magic is for kids age 2 to 12, but if you have a son with autism who's in his early teens, his chronological age may be teen, but his emotional behavioral maturity may be about 30% less than that, so it might be about 10 or 9. So he's into our 1-2-3 Magic area. So what you do is you learn counting, and what you're going to be doing now is a signaling system. Instead of explaining and talking and reasoning, which is likely to sound like nagging to him, you're going to simply say that's 1, and that means you're going to count a behavior related to this problem. Now, what are you going to count? Well, you could count touching feet, but I think that's too late. I think what you want to count is an anticipatory response that leads up to counting feet. And you know your son. Maybe you know that look when he's looking at somebody like he's about to do it, or when he starts bending down. You want to count that anticipatory response with that's 1. You remain calm, you don't do any explaining whatsoever. At 3, that means if he gets a count of 3, you'll learn this in the 1-2-3 Magic book. If he hits a 3, there's going to be either a timeout or a timeout alternative. Now, because of his age, you could consider either. Sometimes it's electronic entertainment that you restrict, but it's a mild consequence for doing the behavior if he hits a 3. So you can decide what you think is the best thing for him. So what you're going to do is learn counting. You're going to count the anticipatory response to the actual touching of the feet, and we'll see what happens with that. So very interesting question, and let us know how it goes.